Knock, knock.
Hello.
Hi, my name is Michelle. I'm going to be your nurse practitioner today and perform hand hygiene. Can you tell me your name and date of birth?
Max Turner, March 8th, 1988.
Perfect. Nice to meet you, Max.
Nice to meet you.
Can you tell me why you're here today?
Here for physical.
All right. And can you tell me where you are?
The clinic.
All right. Can you tell me what year it is?
2025.
All right. Perfect. So based off of my orientation questions, I know that he's alert and oriented ×4. He appears calm and relaxed. His speech is clear, and he's able to answer my questions appropriately. He doesn't appear in any distress. So generally, he's looking okay. Next, I'm going to look at your skin. His skin is pink, warm, and dry, which I was able to assess from shaking his hand. His color is appropriate. The color of his skin is appropriate for his ethnicity. I don't see any wounds or any lesions or any abnormalities on his skin of his torso, his extremities, or his face as of right now. It's okay if I touch your skin? Okay, so just quickly checking for if there's any texture anywhere. I don't feel any texture. His skin feels smooth. May I check your hand, or see your hand, excuse me. Checking his skin turgor. There is no tenting, indicating that he is well hydrated. So next I'm going to look at your head and your face. So quickly, just looking at his head, I don't see any deformities or any masses or any lesions or anything that I'm concerned with looking at his head. And I don't see any swelling. Is it okay if I touch your head?
Yep.
All right, so just palpating on his skull. I don't feel any deformities, any masses or anything abnormal there. His skin is, the skin on his scalp is smooth and it's intact. The patient is willingly bald. He does shave his head, and he does show some signs of a receding hairline, which is not new for the patient, so I'm not concerned with the state of his scalp at this time. Next, I'm going to look at the patient's face. His facial features is symmetrical. His head is also symmetrical in shape as well. The skin on his face is there's no lesions, there's no bruising, discoloration, anything like that there. Is it okay if I touch your face now? Okay. So I'm just going to check your sinuses, your temporal, or your, I don't remember what it's called, and your maxillary. And was there any tenderness there at all? Okay. Also, I'm sorry that I forgot to ask, did you have any tenderness at all when I touched your head also?
Nope.
Okay, good. So knowing that that's normal is great news. Upon touching his sinuses, I was able to determine that the skin on his face is pink, warm, and dry also. And next thing I'm going to do is I'm just going to do a couple cranial nerve checks on you. So I'm going to use this Q-tip here, and I'm going to have you close your eyes, and you let me know if the sensation that you feel is sharp or dull, okay?
Dull. Dull. Sharp. Sharp.
Okay, perfect. And did that feel the same on both sides?
Yes.
Okay, perfect. So knowing that he was able to appropriately assess or determine the sensations from the Q-tip test, I know that his trigeminal nerve number 5 is intact. Next, I'm going to assess your facial nerve number 7. Can you puff your cheeks for me? And can you smile? Perfect. And can you squint your eyes? Okay, perfect. So since he's able to do that, I know that cranial nerve number 7 is also intact. Next thing I'm going to do is I'm going to just take a look at your jaw. So I'm going to put my hands here, and if you could just open and close your jaw a couple times for me. All right. Do you have any pain or tenderness with any of that?
No.
No. Okay. So I did not feel any popping or any grinding in his jaw area. He does have full range of motion, so I'm not concerned with that at this time. Next, what I'm going to do is I'm going to look at your nose. So first, just like looking at your external nose, I don't see any deformities, any lesions, any issues with skin. Your skin is pink, warm, and dry on his face, which we already had determined. So next I'm going to look into your nose, if that's all right. Okay. Have you tip your head back, perfect. And nasal mucosa looks pink and moist. I did not see any polyps or any lesions in there, and I did not see any deviated septum or any abnormalities like that. Next, we're going to look at your eyes, okay? Okay, so first what we're gonna do is I'm gonna have you just close your eyes. I'm looking at the outside of his eyes. I don't see any discoloration, any abnormal drainage, any crusting, or any like nodules or any skin issues that I see. You can open your eyes. Okay. Next, what we're gonna do is I'm gonna have you read this chart. So look at the smallest line that you can, cover one eye, and then read that, and then we'll switch eyes.
LTFPH.
Okay, and then if you could read this line backwards.
HPFTL.
Perfect. So since the patient was able to perform this correctly, I know that his vision is 20/20 and that cranial nerve number 2 is intact. Next, what we're gonna do is I'm just gonna look at your eyes. So I'm just gonna pull down your lower eyelids very gently. Can you look up and side to side for me? Perfect. So looking at the whites of the patient's eyes, they are, the sclera, excuse me, they are white. I don't see any hemorrhaging or any yellowing in color. And looking at the conjunctiva of his eyes, it is pink and moist, no nodules or any issues there. Next, I'm just going to take a look at your pupils using my pen light. So if you could just look at my nose. Great. So the patient's eyes are equal, round, and reactive, and they are 3 millimeters in diameter. Next, I'm gonna look at your eyes a little bit more closely using my ophthalmoscope. All right, so I'm just gonna start with looking at your right eye first. Okay, red light reflex is noted. I'm gonna just put my hand here. I'm gonna move it a little bit closer. Okay, the optic disc, I see the optic disc, it is yellow. It is, it has sharp margins. The retina is attached, and I do see the vessels and the macula is present. All right, next I'm going to look in the other eye. All right, so I see the red light reflex. I do see the vessels again. The retina is attached, and I do see the macula as well. The optic disc was also yellow and sharp margins as well. Okay, so next I'm going to assess your cranial nerve 3, 4, and 6. So I'm just going to have you look at a spot on the wall behind me, and I'm just going to have you, I'm going to have you follow my finger and into separate directions, okay?
Okay.
Okay, so. No, sorry. My apologies. All right, so based off of the cardinal gazes, I know that cranial nerves 3, 4, and 6 are intact. Next, I'm going to look at your ears. So first, I'm just going to look at the outside of his ears. I don't see any deformities or any abnormal drainage, no bleeding, nothing that I'm concerned with. Okay. So next, I'm just going to, I'm also going to palpate your mastoid process, which is right behind your ears. Let me know if you have any tenderness.
No.
Any pain? No. Okay. So next I'm going to look in the patient's ears. All right, so start here, pulling the ear up and back. Okay, the eardrum, I see the eardrum, it is pearly gray in color. I do see the bony landmarks, and there is a small scant amount of wax that is present. The cone of light is at 5 o'clock in this ear. No issues with your ears, correct?
Nope.
Okay. Okay, again, I'm going to pull up and back. Looking in his ears here. Okay. Eardrum. I do see the eardrum. Also a scant amount of wax. It is pearly gray in color. I do see the bony landmarks, and the cone of light is at 7 o'clock. So everything looks great there. All right. The next thing that we're going to check is I'm just going to do a little hearing test.
Okay.
So I'm going to use my tuning fork, and we're going to do what we call the Weber test. So I'm just going to hit my tuning fork, and I'm going to put it on your head, and you let me know if you hear it the same on both sides or if it's louder on one side or the other. Okay?
Okay. Sounds the same on both sides.
Okay, perfect. So that is great for the Weber test. That means that his negative is a negative Weber test, indicating that his cranial nerve number 8, vestibular cochlear test is, or cranial nerve is intact. All right. Next, I'm just going to look at your mouth.
Okay.
All right. So first, could you just open your mouth for me? Just let me see inside. Perfect. His oral mucosa is pink and moist. His teeth are appropriate for his age. I did not see any issues with his teeth at all. Could you stick out your tongue for me? Perfect. The tongue is midline. And oh, let me look at your gums. Excuse me. Okay, yes. And the gums look good too. They're pink and moist as well. So when the patient was able to stick out his tongue, can you do that one more time? You stick out your tongue, and then can you move it up? And then can you move it like side to side so I can see the sides of your tongue? You open your mouth wider, please. Sorry, side to side. There we go. Just like that. And the other side. Okay. So I did not see any lesions or any abnormalities on the tissue of the tongue, so I'm not concerned with that. And then I'm going to use my tongue depressor, and I'm going to look at his the back of your throat a little bit more. Okay. You just say, oh, excuse me. Need a light. That'd be very helpful. All right, can you just say ah?
Ah.
Okay, so the uvula is midline. It is red and pink, or red and moist back there, and I don't see. And his tonsils were 2+, and yeah. The last thing I'm going to do is I'm just going to assess your gag reflex. So I'm just going to put this a little bit further. You just say ah.
Ah.
Okay, great. So that based off of these assessments of his mouth, I know that his cranial nerves 9, 10, and 12 are intact. All right. Next, we're going to move into your neck. And so, looking at your neck, his trachea is midline. There is no deviation. Looking at the skin, there is no abnormalities or any lesions or anything there. Next, I'm just going to palpate your thyroid. So I'm going to come behind you. Perfect. And if you could turn your head to the left for me, and if you could turn it to the right. Hold on one second. Can you go straight for me? All right, and then could you swallow? All right, perfect. So feeling the tonsil, it feels like a normal size. Or not the tonsil, excuse me, the thyroid. Feeling the thyroid is a normal size. I don't feel any masses or goiters or anything like that. Next, I'm going to look at your lymph nodes, if I may. All right, so your pre-auriculars, your post-auriculars, your tonsillar, your occipital, your submandibular, your submental, your anterior cervical, posterior cervical. Okay. Any pain or tenderness with any of that?
Nope.
Okay, perfect. The last thing that I'm going to do is I'm just going to check your carotid artery. So first thing is I would like to listen. Okay, perfect. I don't hear any bruise or anything there. Next, I'm just going to palpate for your pulse and your carotid. Okay, great. carotid pulse is 2+. Next, I'm going to move into the anterior thoracic assessment. So first, just looking at the skin, again, I don't see any abnormalities in terms of the skin, no lesions, no masses, no anything, deformities or anything like that that I'm concerned with. I'm going to assess what we call tactile fremitus. So I'm just going to put my hands on your chest and I'll have you say 99 for me.
Okay. 99, 99, 99, 99.
Okay, perfect. So that felt completely normal. Next, I'm going to listen to your lungs. So every time I move my stethoscope, please just take a deep breath. All right, perfect. So lung sounds were clear, no adventitious lung sounds, and his chest rise was equal throughout. So next I'm just going to I want to palpate his PMI first. So I'm just going to feel here, and I do not feel anything there. So that is good. The next thing that I'm just going to do is I'm just going to listen for the lung sounds, and I will also auscultate the PMI as well, okay? All right. Did I say lung sounds? Heart sounds, excuse me. All right. So, and aortic, pulmonic, herbs, tricuspid, mitral, and then just listening for that PMI. All right, perfect. I just heard S1, S2, no abnormal lung sounds, no murmurs, no S3, 4. Okay, next, I would like to look at if you could turn around, I'm going to look at your back. Assess the posterior thorax. You can move the chair back. Okay, perfect. Okay, so just looking at the posterior thorax, I don't see, again, any deformities, any issues with his skin or anything like that. And I'm going to, first what I'm going to do is I'm just going to listen to your lung sounds, okay?
Mm-hmm.
All right, perfect. Lung sounds were clear throughout, no adventitious lung sounds, so that is great. Actually, could I have you turn and face the camera? Thank you so much. The next thing I'm going to do is I'm going to check for tactile fremitus. So again, I'm going to put my hands on your back and you just say 99 for me, okay?
99, 99, 99, 99.
Okay, perfect. So that felt great, no issues there. Next thing I'm going to do is I'm going to percuss his back. All right, great. So it sounded resonant throughout, so I have no concerns. That exam is normal. Next, I'm going to do what we call a test for bronchophony. So I'm going to listen, and I'm going to have you say 99 for me, okay?
Mm-hmm.
Okay. Oh, excuse me.
99, 99, 99, 99, 99, 99.
All right, beautiful. So that sounded muffled, and that is what it's supposed to sound like, so everything sounds great. The last thing that I'm going to assess here on your back is I'm just going to look for CVA tenderness, or making sure that your kidneys are not tender, okay? Mm-hmm. All right, so finding here. So I'm going to do a little pounding motion on your back, so don't be, okay, alarmed. Any pain or tenderness with that at all?
No.
Okay, so that tells me that he doesn't have any issues with his kidneys, and there's no concerns with pyelonephritis. Okay, you can turn around. All right, actually, so You okay? All right, so moving into the next part of the exam is I'm going to check your abdomen. So if you could lay down, that would be wonderful.
Yep.
All right. Perfect. All right, so first what we're going to do is we're going to inspect the abdomen. His abdomen is flat. I don't see any masses or any abnormalities there. No discoloration or anything to his abdomen. So the first thing I'm going to do is I'm just going to listen to your bowel sounds, okay? Perfect. So his bowel sounds were normal, active throughout all 4 quadrants. So the next thing I'm going to do is I'm going to percuss your abdomen. Okay, so you let me know if there's any issues with this. All right, so that sounded great. No issues with the percussion of his abdomen. The over the liver did sound dull, but that's supposed to. The next thing I'm going to do is I'm going to do some palpation. So I'm going to push on your abdomen, okay? Let me know if you have any discomfort at all. Okay. Any issues with that?
Nope.
Okay. So I'm going to press a little bit deeply this time, a little bit more harder. All right, any issues there?
No.
All right, so that is great. There's no issues with palpation. The next thing I'm going to do is I'm just going to palpate for your liver. So I'm going to put my hand under your back here, and I'm just going to kind of push down. Can you take a breath for me? Okay. All right, and then at this point, I would also, my specialized test that I'm going to check for is going to be the Murphy sign. So looking for cholecystitis. So I'm also going to have you take a breath, take a normal breath, and then take a deep breath for me as I'm pushing down. So the patient was able to fully take in that deep breath. So that way I know that there's no issues with the gallbladder as the lungs are expanding and the liver and the gallbladder are coming down. So no concerns for cholecystitis. Okay, you can sit up. Get you back to the chair. Perfect. Okay. Next, we are going to assess. Okay, so we're going to assess the vascular system. So I'm just going to take a look at your fingers, if I may. So I'm just going to check for capillary refill. They are less than 3 seconds. I don't see any clubbing on his fingers, so that is great. That's to be expected. I'm also going to take a peek at your feet, if I may. Just checking for that as well. Okay, so those are also less than 3 seconds, so I know that his circulation is good to his feet. I'm going to also take a peek at your arms. I don't see any edema here, and I'm just going to take a peek at your legs as well, and I don't see any edema in his lower extremities. And I'm going to also check your sensation, okay? Okay, so I'm just going to use this, and just let me know if it feels the same. Can you just close your eyes for me? Does it feel the same?
Yep.
Okay, and I'm going to do this over here too on your legs. Did it feel the same?
Yep.
Okay, so I know that his sensation is intact and you were able to feel all of that, correct? Okay, perfect. And then the last thing that I'm going to do is I'm going to just check some of your pulses. Okay, so here, radial, good, brachial, and you can keep your feet down. Posterior tibial, dorsalis pedis, and I had already assessed his carotid artery, his carotid pulse, excuse me. So, and they were all 2+ throughout. The next thing I'm going to do is, let's see, I'm going to do a little bit of a neuro assessment as well. So throughout this assessment, I have been assessing the cranial nerves. So most of them have already been addressed at this time, but the following or the rest of this procedure will touch on the rest of the cranial nerves. So could I have you stand up for me? And I'm just going to have you walk here and back. I just want to see how you walk. Perfect. The patient's walk is steady. He's able to walk independently. So I know also that a part of the vestibulocochlear cranial nerve number 8 is also intact because he's able to walk appropriately. The next thing I'm going to do is I'm going to do the Romberg test. So I'm going to have you stand with your feet together, and then if you could close your eyes. And so the Romberg test is going to determine if he has any swaying. That would mean that he would have a positive, or if he did sway, he would have a positive test. No swaying indicates that his test is negative and everything looks great for him. Okay, so the next thing I'm going to do, I'm going to have you sit down, please. I'm going to check some of your deep tendon reflexes. So I'm just going to take a peek at this one first. Okay. And the do it one more time. Perfect. And then I'm going to check the patellar. You just relax. Okay. All right, so the patellar reflex is intact. I did check the brachial and the radial, or no, excuse me, the brachial and the biceps. I do need to check the triceps as well. So I'm just going to have you relax, just kind of dead weight your arm. Okay, and last one. Oops, excuse me. Okay, perfect. So all of the deep tendon reflexes were 2+, which is normal finding. All right. So the last thing that we're going to do is I'm just going to assess your musculoskeletal. So if you could please stand up for me, and I'll have you turn. So let's have you turn this way. If you could just bend forward for me. So I'm looking for scoliosis here. He has a well-symmetric spine. There is no lateral curvature, and you can stand up. And his shoulders are even and symmetrical as well. So I'm not concerned for any scoliosis at this time. The last thing, or a couple more things we're gonna have you do. You can sit down for me, please. I'm gonna check your range of motion. So if you could just put your arms up and over your head, to the sides, behind your back, and across your chest. Perfect. So he has good range of motion for his upper extremities. Can you do this to your hands? Perfect. Can you roll your feet as well? Okay, looking at that. Okay, great. And then can you extend your knee and bring it back? And then can you do the same on the other side? Perfect. And then I'm going to check your strength also on your upper extremities. So can you just squeeze my hands for me? Perfect. And then put your hands up like this. Yep. And don't let me pull you back. Okay, and then don't let me push you. Okay, and then I'm going to do the same for the lower extremities. All right, don't let me push your leg back, and don't let me pull it forward. Okay, and then same, and don't let me pull it forward. All right, and then same, I'm going to check your feet as well. So kind of like a gas pedal, push on my hand, okay, and then pull up on my hand. And then same gas pedal, and pull up. Perfect. All right, so his strengths are 5 out of 5s for upper and lower extremities, and his range of motion is good. And the last thing I'm going to have you do is we're going to do the, I'm going to check your cranial nerve 11. So I'm going to have you push up on my shoulders. Okay, good. So cranial nerve 11 is intact. And the last thing that I'm going to do is the Phelan test. So I'm going to have you stand like this, or yep, just like that. So he would hold that for 60 seconds. And if he had any sort of numbness, tingling, or any pain, that would indicate that he had a He had an issue with, I can't remember. Okay, thank you.